Hello, this is Franke at Achieve Alpha Insurance, giving you an overview of the 2024 individual health insurance plans from November 1st to December 15th for January 1st coverage. Below is our phone number. You can call or text us or email us down below. This is just an overview presentation. Check the carrier websites and the Washington Health Plan Finder for exact specifics for your situation. If you want to find us, go to achieve-alpha.com/health insurance. To make an appointment, you can click on the button below. To play this presentation, you can go there. We're a full-service insurance broker. We do individual health insurance, Medicare, accident, dental. I do a lot of life and disability insurance, and we have a long-term care insurance partner as well. If you are trying to get support from a broker, click on the Get Support button. Click on Find a Broker. It will take you through the process here. Once you're in there, you want to click on Report a Change. You do not want to create a new application if you have one already. To the right-hand side, you will see Message Center. Every email or letter sent to you is in that section. They kind of hide it over there, but that's a very, very good resource if you can't find a letter or anything along those lines. If you don't have a broker, click on the Find a Broker button or Manage a Broker. Put in my last name, Franke, Franke, and click Search, Request Help, and we'll get the help request. There's no cost to add us as a broker. Any commission we make is built into the price, so it's free for us to help you out. The first thing is the Smart Plan Finder is not smart. Do not trust it for find a doctor and finding prescriptions and doctors and hospitals and stuff. It's moderately accurate. You must go to the individual health insurance company's website and look up doctors that way for actual confirmation. The filter by button is where you're going to find all the different insurance carriers and the gold, silver, and bronze plan. So if you want to narrow it down, go there. For example, we're just looking at the Cascade Silver plan here. The Cascade Silver is a very good plan. If it says Cascade Select Silver, that's a very narrow network. I would avoid anything that says Select in it. For example, coordinated care is Ambetter, so if you are searching for that, that's one way to look it up. For 2024, here's the rates. If you want to stop this presentation anytime, please do so. I'm going a little fast just to keep it as short as I can. But for all intents and purposes, Ambetter is going to have the lowest price for the coverage next year. So if you're looking for a lower cost plan, that can be a good option. Regents is also not raising rates as much, so that's a very attractive option for a little bit better network plan. Primera and Kaiser Permanente are raising it by about 17%, so quite a huge increase for those plans. But it just depends on what your needs are. Every carrier has good plans for the price, depending on what your needs are, the network, along those lines. As I mentioned before, Cascade is the same network for regular, like for example, a Regents Cascade plan or a Regents regular plan. Cascade Select Silver, which Regents does not have, that is a smaller network. For tax credits, it's based on your 2024 modified adjusted gross income, capital gains, dividends, interest, real estate income. If it's taxable for 2024, we just need to estimate what you're going to make next year. If it's more or less, it will adjust on your tax return for the next year. We're not accountants. We can't give accounting advice. We can just help you come up with a number that you give to us from that side of things. For prescription drugs, tier 1 is cheaper, tier 2 is more expensive. This is kind of an overview as you want to look at different tiers for drugs and how those are functioning. LifeSecure is one of the insurance companies we work with for like accident insurance. So if you're accident prone, have kids in sports, it can be a very effective type of structure from that side of things. We also sell hospital recovery insurance. So if you get hospitalized, it can cover up to $900 a day. Here's the accidents by sports, activity, and age, if you want to look those up. Here's a way that we've been saving people a lot of money. For example, this is a real situation. A family was about $1,400 for a silver plan, and they're not getting any tax credits. So this is just straight up. From that perspective, it's about $300 a month more than the bronze. So what we did is they have kids in sports and activities along those lines. So it was $1,092. They actually used this plan. It was really interesting. It saved them several $1,000s because they just went to the emergency room, and it saved them a lot of more money than the silver plan would have, ironically. Here is the health insurance carriers and hospital networks. It hasn't changed this year. The carriers are all keeping things very, very similar. So if you're on a plan, most likely the same plan. If nothing's changed, just stay on the same plan for all intents and purposes. This year we updated the doctor network, just giving you a few additional major doctor networks. This is mainly in Western Washington for the most part, but just giving you a few, kind of showing you how the carriers cover things from the doctor networks themselves. There are three basic plans. Every company has the same plans: gold, silver, and bronze. If you're going to have a major medical expense, having a baby, having a knee surgery, or some sort of procedure, or a really expensive prescription, sometimes gold's the best. If you're using a moderate amount, like a diabetic, a lot of times a silver plan can be an effective plan for the price. Or if you don't use as much, a bronze is a more basic plan, but it's a very cost-effective way of doing things. Getting into the individual health insurance carriers, Ambetter has coverage in 26 states across the nation for regular in-network coverage. One of the downsides to Ambetter is that they have a smaller network of psychologists and some independent providers, but it's a moderate network of independent providers overall. But Ambetter is going to be the cheapest plan for the price and have the coverage network for this year. They're going to get a little bit cheaper compared to everybody else just because their rate increase is less. So if you're on one of those plans, most likely stay on one of the plans. The Bronze Plus was the most popular plan for 2023. It's a little bit more than the Cascade Bronze, but it's not quite as expensive. The Ambetter Gold is not much more than the Silver, so a lot of times that's a very effective option. Regions had a lot of competitive plans for this last year. They're in 4 states: Washington, Oregon, Idaho, and most of Utah. But they have the Blue Card Emergency Room Network and for urgent care. So if you're going to an urgent care center anywhere in America in the Blue Card PPO network, it's a very effective plan for the price. So the Regions plans have a good price for the coverage, especially since Premera is raising prices by 17%. LifeWise is owned by Premera. It has a very similar network, and it has a large network of independent doctors, but it has a smaller hospital network. So it mainly covers Swedish and Providence for the most part, and not really as many other ones or any of the doctors that go to those facilities. Also, Premera and LifeWise only accept payments from a personal checking or credit card. They will not accept it from any business account, so just letting you know that. Premera is the best network for the price, but it's really expensive and it's going up more this year. If it's getting out of your price range, maybe Regions might be willing to look for, but Regions does not cover Swedish and Providence, so that isn't, kind of an issue there for some people. Kaiser Permanente isn't changing their plans very much for the year. Their Virtual Plus Silver and Bronze were very effective for the last couple of years, so that's something to look at from there. Molina Marketplace has not changed their plans for this last year. Everybody's keeping pretty similar. They have effective plans for the price as well. United Healthcare, they're not changing the plans. Regions is about the same price as United Healthcare, but just a better network for the most part in situations. Health savings accounts, the main ones on the exchange are Premera and LifeWise if you're going to get tax credits. Otherwise, you can go direct to Regions. Look to the left-hand side on the limits for this next year. We're not accountants. We can't, go through that part of things, but we can kind of guide you through the process on those. For vision insurance, we use VSP. Very effective. If you use glasses, get the plan. If you don't, then don't. One of my favorite dental plans is Emeritus. For the price, they have very effective plans. You can see the networks below if you're calling your dentist. That's the networks that they have for those. It covers not quite as many as Delta Dental, but if it does, you can pick the Advantage Plus network. Otherwise, the one at the very bottom, you can use any dentist in America. So it's a very effective cost. Here's just an outline of how that coverage works. The new insurance company for the year for dental insurance is Companion Life. They're literally brand new, so I just had to dig into these recently. All of their plans have a 6-month waiting period for fillings, which all the other plans do cover immediately, so just letting you know. But they also have out-of-network coverage. So the in-network coverage is Dentamax if you want to look into the doctor network. Going directly to Dentamax is better than going through the Companion Life website because there's like 20 different options there. But we're going to kind of go through this. These plans are cost effective for the price for the most part, but like Emeritus is a little bit cheaper for like the Premier PPO that has 2,000 coverage rather than 1,000. Here's just an overview of what the different plans cover. You can pause this to go through those more specifically. Delta Dental does have the largest network. They're also the most expensive. Here's an overview of the plans. Most people, if you're going to get a Delta dental plan, get the premium plan. It's just more cost effective. The clear plan can be ineffective, but there are limitations on per services per year, and there's no waiting period for those as well, kind of like the Ascent plan. Here are the Washington Health Exchange plans. For adults, the Delta dental plan does not cover major dental, like root canals and crowns. For children, if your child under the age of 19 is getting dental, a lot of dental, the Delta dental on the exchange is very good for children, but not for adults. So you can see down below for additional information. Cost share plans can be effective. We just don't sell them as much anymore since there's more effective options with getting tax credits for health insurance. So in conclusion, if you have any questions, give us a call or text message 425-802-2783.